Who didn't know that? Installment 1, exercise. All right, everybody knows that exercise is good for you. No news there. You're going to feel better exercising, but here's the information that I hope is new to you and that you can work with. So the following information is researched heavily, and so it's just solid information. Here's what you do. You take the resting heart rate and you raise that by somewhere between 60 and 80%. And I say somewhere between that because there's been so much information that some research shows that there's value for as little as 60% raise above resting heart rate, but usually it's about 80%, which isn't hard to do. A slow jog will get you there. A light elliptical will get you there. Doesn't require much exercise. The key, though, is that you got to sustain that amount of exercise or resting heart rate increase for at least 20 minutes. Here's what happens. After the 20-minute mark, the neurochemicals, you've probably heard of these, endorphins that are feel-good neurochemicals, serotonin, more feel-good chemicals, dopamine, they're reinforcing chemicals. These get released from the vesicles in the brain more rapidly. So, like, let's say that a normal release is at a rate like so. After 20 minutes, that starts to be increased. Now, the key to this is that when we do this, it's not just good enough to get exercise for that day. Although, I'll emphasize that it is always better to get exercise than not get exercise. So, you know that. The key, though, is that there's this thing in the brain, you may have heard of it, it's called neuroplasticity. What neuroplasticity shows is that there are changes that occur to the brain over time. Now, the way to think of this is kind of like in its opposite. If a person goes to get drunk one time, that's no big deal. They just get drunk. But if they go get drunk 3 or 4 times a week for the next year, well, then there are changes that occur in the brain that are not something that they'd hope for. The idea here is to get cardiovascular exercise on a regular basis so that the neuroplasticity in the brain will take effect and you will feel happier and better all the time when you do this over time. And the research on this is solid. Okay, I want to toss out statements like, okay, well, I will. The research shows that in a lot of instances that it's more valuable to a person than taking any kind of mood-altering or psychotropic drugs. Sometimes it's even better than going to see a therapist with talk therapy. Now, it really depends on the person and their condition, of course, but this is huge. You want to go get regular exercise, raising the resting heart rate by about 80% on a regular basis. You will feel better. What can I do? Promise, guarantee, I assure you, it's going to work.